My name is Omar Mwalim from Zanzibar, and currently I'm a PhD candidate at the University of Bergen under the Bergen Centre for Ethics and Priority Setting. So today I'm here to present the 10 steps revision framework. This is the framework that we use to define the essential healthcare package in Zanzibar. And then I'll try first to talk about the plan itself, and then I'll take you to the real implementation to see how the plan differs from the real implementation. So now, let's look at the plan first. So here you see how beautiful the plan looks like. Well planned with clear steps, and you see all 10 steps categorized under different work packages. So, I mean, if you look at it, you see it's a beautiful thing. And just looking at it, you see, well, it is something that maybe you could just implement in a week or 2 weeks or even a month. But then, is that the reality? So let's now go to the reality and see how the real implementation looked like. So you see, this is how the real implementation looked like. If you look at the nature of the road, with downhills, uphills, the corners, it tells you that it reels a careful driving to reach your destination safely. And otherwise, you might ever turn over along the way. And because of the nature of the road, that's why many scholars named the process of revising the essential healthcare package differently. Some they said it's a muddy process, but also it requires a lot of willingness, it requires ownership, and it requires commitment. And all these are needed at all levels, from political level to the ground level. But again, it needs a massive stakeholders engagement, because every citizen has a right to participate in this. Every scholar, every institution, and everyone receiving the healthcare services in the country needs to be engaged in this decision-making process. But again, in order to make sound and scientific decision, you need to have a lot of data to guide you through the process. But again, the process requires multiple skills, because you need health economics, you need epidemiologists, you need medical doctors, you need statistician and everything. So you could see how complex the process was. So now, let's shift the components of the plan into the real implementation. So to begin with, this was the first step where we developed the roadmap and we installed the team to undertake the whole exercise. I would call this excitement stage, because by the time you go to the country and introduce the project, everyone is so excited. You could easily get the roadmap passed. You could easily get the number of staff to be involved in the process available and everything. And sometimes you can even be asked, how many people you want to undertake this exercise? Then you get the people you want, you get the roadmap and the plan all approved easily. And this is where you see the downhill of the process. So you might be deceived at the beginning, but then starting to the next step, defining the criteria, because it is not the technical team which decides on the criteria for selecting interventions. Then you need people to decide which criteria should we use. And now you're talking to the people who have no idea about the criteria. So that's where the thing begins. So you find yourself take a lot of time defining the criteria until you agree on the criteria. And after that, in the second corner, now coming to the selection of candidate interventions to go into the package, and as well as the coverage. So these are two different things. Selecting interventions, here you see a lot of arguments and fighting between the clinicians and the ordinary people. Because, for instance, the clinicians, they just want everything to be included in the package. And coming now to see the coverage, particularly the baseline coverage, the data is not available. So what do? So you see, you might spend like 6 months just on this one component of the process. So here it tells you how the process, how tough the process is. And then coming to collect all the evidence. After having the interventions, now you need to see, okay, how much do we need to invest for each intervention? How many lives we're going to gain for each particular intervention? So again, it's another tough thing. But again, you need to know about the fiscal space, and you need to know how you're going to finance the package itself. Again, with limited resources that we have, then it takes another long time, and it's not easy to get to this one. Again, after having all the interventions and everything, now you need to set priority. Which should be high, which should be low, which should be medium priority intervention. Again, this is another thing that takes a lot of time, and it requires a lot of attention, to do it. Again, the implementation, you need to carefully plan how you're going to implement the package, and after that, coming to the monitoring and evaluation. When you get to this stage of monitoring and evaluation, that's where you see the downhill a little bit. But again, you need to make sure that you carefully have a proper monitoring and evaluation system in place. So, after going through, you get to see here how the decision was made, the final decision was made. As I mentioned earlier, that we had an intensive deliberative process where we engaged a number of stakeholders from community to the higher levels. Then the core team, which was previously defined, it took all those what was agreed in those deliberation meetings to the higher levels for decision making. And if you could see here first, we started with the Ministry of Health level at the Executive Committee meeting, where this committee is led by the Principal Secretary. And after that, we went to the Leadership Committee meeting. This is led by the Minister for Health. And then we went to the Multi-Sectoral Technical Committee. This is led by the Chief Principal Secretary of the Government of Zanzibar. And finally, for the approval, it went to the Minister's Cabinet, which was chaired by the President of Zanzibar himself. So, well, there were rewards during that process, although it was a tough process, but at least we have a very good policy document in place, and this policy document can guide us through the resource allocation and resource mobilization, but it also enables us to plan accordingly. But the most important thing that we managed to obtain as a reward is capacity building. Through this process, we managed to build local capacity on health economics and priority setting. All people who were engaged in this exercise, they got training on health economics, they got training on priority setting. So that's all, at least I could say for today, related to this process. Thank you very much.